As you can see, we're still using the 1064 wavelength, but unlike the hair removal treatments, which we did at fairly low powers, say 40 or 50 joules per square centimeter, these blood vessels require a very high power. Now we're looking at 220 joules per square centimeter. The reason for this is all these devices work through what is known as selective photothermolysis. That means you have certain pigments in your body, whether it's hair or blood in the case of a vein, or simply water or collagen in the case of skin rejuvenation. Each of these pigmented targets is capable of absorbing at 1064 nanometers, which is our wavelength, but some pigmented targets interact more readily than others. In the case of blood, when using a 1064 wavelength, it's not as absorptive as, say, hair, and so hence we have to use a much higher power in order to get this to function. So in learning these devices, they're quite complicated in understanding the underlying physics and the basic operation, but over time as you familiarize yourself with the device and learn some of the basic strategies whereby we would choose a longer or shorter pulse duration or a certain wavelength or energy setting, it becomes more clear. We have additional treatment protocols also for fine leg, as well as dark circles under the eyes, and some other types of scars such as a keloid, which is a very aggressive scar that's difficult to treat. Okay, so back to our screen. You can see down on the bottom of the display we have several wavelengths. We have the 1064 and we have the 1320, as I mentioned. Next to that we have two other wavelengths. We have the S1064 and the S1320. These are in fact the same wavelengths, however the S indicates that these are very short pulse durations, under just a few hundred microseconds. We use these for when we need just very, very short bursts of power. Also, you can see there are a couple other buttons down on the side here. The little snowflake button controls the delivery of energy to the sapphire window, cooling it. Right now, we have two little snowflakes up here, meaning this sapphire window is as cool as it possibly can get. However, in some cases in which we're trying to actually heat the collagen, or in which the handpiece is not directly opposed to the skin, there's no purpose to do contact cooling, and we simply turn it off, controlling that button. This next button enables you to have an aiming beam. There will be a small red light that's delivered through the bottom of the handpiece, which it's difficult to see. You probably have to see it in person. But the purpose for that is if you're trying to hit something very, very small like a blood vessel, sometimes they're only 1 to 2 millimeters in diameter. You'd like for that to be in the center of your spot, and that's the utility of having an aiming beam. And I'd like to take a break for just a moment. Hi, we're back. As you can see, I've got my space age eye protection on. This is one of the most important things to remember when you're working with medical lasers. The most dangerous thing that these lasers can do to injure a person is to injure their eyes. I'm wearing special glasses right now that protect me against the 1064 wavelength. It's important when you pick up a pair of glasses that you check and make sure that you have the right ones for your machine, because each machine may have a different wavelength and it may have a different associated pair of glasses that you use to work with it. So we have our eye protection on here in the room, and we're ready to show you a procedure. One of the most commonly sought after procedures in the cosmetic market is hair removal. So we've elected to treat our friend Erica for an axillary hair removal session, and I'm going to take you through an example of what that looks like. If we pan over here to Erica, we have her on the table wearing her eye protection, which is very important. She's already shaved and cleaned for the procedure, so you don't see much hair now, but if you zoom in close, you can see there's still some small little whiskers of hair in the axilla. Because these procedures can be painful, if not cooled to the skin, we provide some gel. The gel goes into the treatment area, just a thin layer, and it actually acts to conduct the heat away during the laser procedure. So the gel combined with the contact cooling will greatly increase the comfort to the patient. I have the device set up and ready to go over here. I've selected a fluence of 64 joules per square centimeter. That's a little bit higher than you might start for a first procedure. However, Erica's had several treatments with us already, and this is a fluence that we've worked up to as we try to remove the last of her hairs. one treatment never gets rid of all your hairs because the hair goes through maturation cycles in which they're more or less sensitive to the laser light at times during that cycle. So at least 4 or more treatments can be required to provide long-term permanent hair reduction. I have selected the 40 millisecond pulse duration, which I feel is the most appropriate for the hair that we're treating. So I'll remove my handpiece from the holster. We have a 10 millimeter spot size selected, which of course is indicated on our treatment display. And I have a foot switch that I use to activate the device. I have contact cooling turned on. The way I approach hair removal treatment is first to, before firing the laser, is to make sure we start cooling the skin. That happens by placing the sapphire window directly onto the skin itself. Rather than drop it on and fire right away, I usually wait a second or two just to allow the skin to cool. And when I'm ready to fire, I step on the foot switch. And you see there's a small flash of light and a little beep from the machine telling me that it's fired. I then remove the handpiece and check to make sure there's no problems in the treatment area. I'm looking to see if there's erythema developing or any blistering or problems like this. And as I expected, giving her previous treatments, this is going to be tolerated quite well. So I'll proceed with the treatment by placing my sapphire window back in the treatment area, and now I can just continue to proceed in a logical direction as I move along. At any point during the treatment, if Erica is feeling uncomfortable, she'll let me know and I'll stop. One of the things that can happen is, although we're cooling a particular area and we move on to the next, ultimately you can get cumulative heating that occurs in the tissue. So sometimes it's nice for your customer if you just take a quick break and give them a chance to recover and allow the sapphire window to cool to its maximum capability. So I'll move back to the other end and we'll again proceed in a logical manner. It's okay to have slight overlap with your previous treatment area. How's that feel, Erica?
Good.
And again, another pass. This device is capable of delivering nearly 100 joules per square centimeter. And in this case, I've selected 64 joules per square centimeter, so we're about 2/3 the maximum power that can be delivered. One of the benefits of working with the 1064 wavelength is that it has less interaction with melanin, making this particular type of hair removal modality safer for darker skin types. One of the problems with laser and IPL treatments is that the melanin, which is what gives our skin its dark color and protects us against ultraviolet radiation, is also sensitive to laser light. If you have a laser or IPL wavelength that's in the 500 or 600 nanometers, there's going to be much more melanin interaction than, say, a wavelength that's in the 1064 nanometer domain. For that reason, I feel much more comfortable treating darker skin types with this 1064 device than I would, say, using our IPL device that works in the 530 or, say, 640 nanometer domain. I'm just going to finish up here. We've got about one more pass to do, and then we'll be all done. There you go. As you can see, that entire treatment only took me a few minutes. This makes this a very lucrative procedure for the physician, as the price for these treatments may be anywhere from $100 to $300 or more. Most of the procedure is simply prepping the patient and completing the consent forms and setting up the device. The discomfort to the patient was very minimal, which makes this a very rewarding practice for a physician.